you've been seeing everywhere breast cancer awareness because October is breast cancer awareness month. So a lot of organizations, hospitals are creating awareness against breast cancer. In the spirit of that, let me share with you the risk factors, 9 risk factors in developing breast cancer in women. One of the risk factors of developing breast cancer in women, number 1, is personal history of breast cancer. If you as a woman, you've had any history of breast cancer before, there's a probability that you are also at a high risk of having breast cancer, either at the same breast or a different breast. Number 2, history of breast cancer or any other cancer in your family. Now let's say someone in your family, your uncle, your aunt, your grandmother, your great grandmother, your mother, or your sister have had any history of breast cancer or any cancer. Let me say ovarian cancer, cervical cancer. You are also at a risk of having breast cancer. 3, mutation in the BRCA1 and BRCA2 gene. Now, genetic mutation in this BRCA1 and BRCA2 gene keeps you at a high risk of having breast cancer. Why is this so? These BRCA1 and BRCA2 genes are known as tumor suppressors. They play a vital role in the regulation of the growth of breast cells. Now, if a parent passes down a mutated gene of this BRCA1 and BRCA2, as an individual, you are at a risk of having breast cancer. Number 4, large breasts. A lot of ladies love large breasts, unlike me, and whatever reason you have is personal to you. However, there are the negative side effects of having a large breast. Compared to fat tissues, large dense breasts have more of milk ducts, connective tissues, and so on. Now, you can only detect breast density using mammogram. But the issue there is that this dense breast look similar, they are whitish, just as tumors, and fat cells are dark, thereby concealing tumors. So it is going to be very difficult to interpret results of a person that has large dense breasts. So that is why having large breasts keeps you at a high risk of having breast cancer. Number 5, late menopause. Now, if you experience your menopause after 55 years, you are at a risk of having this breast cancer. Why is that so? This is because of the hormone estrogen. The ovaries produce estrogen. Now, after those age, and your body is still producing estrogen, you are exposing your cells to estrogen, which contributes to the risk of breast cancer. 6, late or no pregnancy. Now, if you as a young lady, you have pregnancy maybe at a later age, later than 30, or you don't even get pregnant at all, you stand at a risk of what? Having breast cancer. This is because with pregnancy comes a halt in estrogen. That means when you're pregnant, your ovaries are not producing estrogen. So with that, your body or your cells are not exposed to estrogen. Hence, you are not what? You are not at a risk of having breast cancer. Number 7, hormonal replacement therapy or treatment. Now, when you take drugs that help, hormonal treatment, you stand at a risk of what? Having breast cancer because of this estrogen that are in most of those drugs. You are exposing yourself, you are exposing your cells in your body to this estrogen. So you stand at a higher risk of having breast cancer. Number 8, being overweight. After menopause, your ovaries, which is responsible for producing the highest amount of estrogen in your body, completely stops producing estrogen. The next thing that starts producing or produces estrogen in your body are fat cells. However, the amount of estrogen these fat cells produces is very small. So when you are overweight, you have more fat cells, thereby leading to the increase in the production of estrogen, keeping you at a higher risk of breast cancer. Number 9, estrogen. I have listed a lot of things that is accompanied with this estrogen and the risk of is breast cancer. Now, estrogen, either endogenous or exogenous estrogen, keeps you at a high risk of having breast cancer. Endogenous estrogen, which is estrogen produced by your body through the ovaries, can increase your risk of having breast cancer. Number 2, exogenous estrogen, which is estrogen that you get from external sources, maybe hormonal replacement therapy or oral contraceptive, also increases the rate of estrogen circulating in your body. And the more estrogens are circulating in your body, the more your breast cells are exposed to it, the more your risk to having breast cancers. So these are the 9 risk factors in developing breast cancer in women. And having known this, you can be able to prevent yourself from breast cancer. Share this video to spread more awareness, and do not forget to follow for more health tips.